Hi there, welcome to episode 3 of my pelvic health mini-series. During episode 1, we looked at the pelvic floor and its normal function. Then during episode 2, we looked at the relationship between the pelvic floor and the bladder and the problems that we see there. And today in episode 3, we're going to look at the relationship between the pelvic floor and the bowel. So during episode 2, when we talked about the bladder, urinary incontinence, and those kind of issues that we see, we talked about the media and how the media portray those symptoms as something that are quite normal and something that we probably should be just putting up with as women, particularly having had babies. So with the bowel, that's certainly a little bit different, okay? So because the media does talk a little bit more openly about urinary continence, although a lot of women are shy about it and don't seek support quickly enough, they are more likely to maybe pass a throw-in comment like, I daren't go on a trampoline, or now I've had my kids, I can't sneeze without leaking urine, that kind of thing. So they might be amongst their friends and just sort of let those passing comments sort of come through, and it's normal, so nobody really bats an eyelid. But with problems with the bowel, there's nothing really in the media that's discussing this at all. So it can be a real struggle for women to deal with experiencing these symptoms, and they certainly, unless they're really comfortable with their peers, are unlikely to express that they're having any problems. So I hope that you've watched episode 2. If you haven't, then it might be worth going back to it. Even if you're not experiencing bladder issues, it's quite interesting that when you look at the pelvic floor and its function, that we see that some of the problems that we see with the bladder sort of mirror that we see with the bowel. So we explored in the bladder episode that it's more than just a weak pelvic floor. There can be several things going on. Sometimes the pelvic floor is too tight and we think, how can that possibly be a problem? But it can be. We talked about sphincter issues and that kind of thing. And we're seeing those same problems with the relationship with the bowel and the pelvic floor. Okay. So one of the symptoms that women might experience is an increased urgency to go for a poo, increased frequency. They might be seeing true incontinence in severe cases. So some women and men, if they're having issues here, might feel that once they feel the need to go for a poo, they've got to get to the toilet pretty quickly. The pelvic floor is not there to support them being able to hold on as long as perhaps they normally should be able to. So that can be a real worry. It can reduce the person's confidence to go out and about if they think, oh gosh, is there going to be a loo close by? So it can really influence somebody's life. So increase in urgency, frequency, there might be true incontinence. If you are experiencing any fecal incontinence, please speak to your GP. Do not put up with it. You do not have to put up with any of these symptoms at all. So those symptoms can be associated with a weak pelvic floor, and we've talked about the risk factors for a weak pelvic floor, and it's more than just having kids. There's other things there as well, and if you do have a weak pelvic floor, we want to improve its functionability. So it's not all about strengthening it. It's not about squeeze necessarily. When we do pelvic floor exercises, we want to be doing them efficiently and correctly. And also we need to know how to release these muscles. So the next video, episode 4, will be how to activate your pelvic floor correctly and efficiently. So if you have got those symptoms, it might be that it's a weak pelvic floor. Okay. So another symptom that we might see with bowel function related to our pelvic floor is an issue with sort of keeping clean. So you might find that you pass a stool and you can be wiping all day long and it just doesn't seem to sort of come clean. And it might be that you've wiped and then later on you notice in your underwear that maybe there's a little bit of staining there. That can be associated with a weak pelvic floor as well, just not holding the rectum up as it should do. But it can be to do with the sphincter as well. So with our anal sphincters, there's 2 of them. And when we wipe, they should close off, enabling us to keep clean. So I've put this series together because I want women to feel confident to talk about these issues. So I'm going to talk about issues that I experienced. So with regards to bladder, I've always been pretty good with that. Very occasionally I will have some bladder leakage, and usually there's some sort of relationship between where I am in my menstrual cycle. So at some points with hormones, the pelvic floor is slightly weaker, but I'm very aware of that, very in tune with that. But with regards to bowel issues, so the sphincter issue is something that affected me. So having had my children, it was always sort of a bit of a joke really. I would say my sphincter's not quite what it was. So this is not easy for me to talk about, particularly on YouTube, but I'm going to do it because I want women to feel confident to talk about these issues. So hemorrhoids was another big thing for me. I had both girls and experienced piles after giving birth, and that's really, really common, but it's something that we want to correct pretty quickly, just to make sure that we don't have ongoing issues. And hemorrhoids, again, for me, if I suffer with them, it's usually correlates with where I am in my menstrual cycle. So if the pelvic floor is a little bit weaker, according to my hormone levels, then sometimes I might suffer with hemorrhoids again. So I sought out some support from a pelvic health physio, so she could have a look and see what was going on there. So she did. She checked on the anal sphincter, both of them. The strength was okay there, the functionability is okay there. She just gave me a couple of tips to try and improve the strength and the function there, and it worked. So I no longer suffer with those symptoms. So that was something that I dealt with, maybe put to one side for some time, but decided, right, we've got to get this sorted out. So that is what I did. So we can see weak pelvic floor causing problems with the bowel, sphincter issues. Also, some women will struggle with constipation. Now, constipation is quite a big issue for the pelvic floor. So if we're having to strain to go to the toilet, then we're putting pressure through the pelvic floor, which can cause it to have to stretch. And then again, that can make it become weak. But for some women, the reason that they have constipation is because they have got a hypertonic pelvic floor, which is what we talked about in episode 2. So if you're not able to fully release these muscles to have a bowel movement, sometimes it can make passing stools a bit of a problem. So you might have very slim, thin poos, or just really struggle to go. So when we're getting in tune with this part of our body, learning to connect with it, we need to learn how to strengthen it, lift, but also to release. So if constipation is an issue for you, it might be worth looking at the bladder episode and then episodes further along in the series, just to see if maybe your pelvic floor might be too tight. That could be what's causing you your problem. So if you have got constipation, again, speak to your GP, seek support from a women's health physio if you think there's a relationship with the pelvic floor. In the meantime, though, you can look at diet, try to increase fibre, supplements like psyllium, things like that are really good at helping to pass the stool. And I would encourage you as well to think about how you're seated when you go for a poo. So I say poop like a toddler. So when I watch my little girl, now she's potty trained, sometimes she'll use the toilet. So she has her little seat that goes on the loo. And if she's going to go for a poo, she will hoink her feet up, right up onto the toilet seat and create this like squatted posture. And that just helps her body be in the optimum position to pass a stool. So if you are constipated, helping to optimise your positioning while you're seated can just help you to relax the pelvic floor and just be in a better position. So you can get little stools that you pop your feet up on, will just lift your knees higher than your hips so you can poop like a toddler. But please don't just put up with it. Sometimes when you're breastfeeding you think, oh, I can't take anything to help, sort of laxatives and things like that. But please seek some support if you are struggling. Finally, we might see bowel prolapse, and we talked about some of the sensations you might feel with that, sort of the dragging sensation, abdominal discomfort. With bowel prolapse, it might be visible externally as well. And again, please speak with a doctor if you're having any issues passing a stool, if you've got ongoing pelvic discomfort, pain during sex, anything like that. We need to get this sorted and corrected for you so that you can live a normal and full life going forward. So I'm a personal trainer. I'm not a GP, I'm not a physiotherapist, but I am keen for women to feel that they can talk about these issues a little more readily. I love it that sometimes in my fitness classes these conversations do come up, and we talk about the pelvic floor, and once one woman expresses it, you quite often say, oh yeah, I experienced that, or no, it's the opposite for me. What might that mean? So all these videos are being put together to just encourage you to explore your own symptoms. And I've said it before, become the scientist of your own body. So make a note of symptoms you're experiencing. So when you go to see your GP, they don't just immediately go down the weak pelvic floor pathway. It could be that, but it could be more than that. So the more you can give them, the easier it is then for them to sort of think about making a diagnosis for you. So takeaway points really, poop like a toddler, just check in with your body, make note of any symptoms that you're experiencing, and do not hide away from it.